In vitro fertilization, IVF, is a type of assisted reproductive technology, ART, used to help individuals and couples who are experiencing fertility problems in conceiving a child. The process involves combining sperm and eggs outside the body in a laboratory setting to create embryos. Once the embryos have formed, they are then transferred into the uterus, where they may implant and result in a pregnancy. Here's a step-by-step overview of the IVF process. Ovulation stimulation. The woman undergoing IVF receives hormonal medications to stimulate her ovaries to produce multiple mature eggs. Normally, a woman releases only one egg per menstrual cycle, but in IVF, multiple eggs are desired to increase the chances of successful fertilization. Egg retrieval. When the eggs are mature, a minor surgical procedure called egg retrieval, follicular aspiration, is performed. A doctor uses a thin needle to remove the eggs from the woman's ovaries, guided by ultrasound imaging. This procedure is usually done under sedation or anesthesia. Sperm collection. On the same day as the egg retrieval, the male partner or a sperm donor provides a sperm sample. The sperm is then processed and prepared in the laboratory. Fertilization. In the laboratory, the eggs and sperm are combined through conventional IVF or a variation called intracytoplasmic sperm injection, ICSI. In conventional IVF, the sperm is mixed with the eggs and left to fertilize naturally. In ICSI, a single sperm is directly injected into each mature egg to facilitate fertilization. Embryo culture. After fertilization, the embryos are cultured in the laboratory for a few days to allow them to develop. The embryos are closely monitored during this time. Embryo transfer. Once the embryos have developed, the best quality ones are selected for transfer. A thin, flexible catheter is used to transfer the embryos into the woman's uterus through the cervix. This procedure is usually painless and does not require anesthesia. Pregnancy test. Approximately 10 to 14 days after the embryo transfer, a pregnancy test is performed to determine if the IVF procedure was successful. If implantation occurs, the woman becomes pregnant. It's important to note that IVF success rates can vary depending on various factors, including the woman's age, the cause of infertility, and the quality of the eggs and sperm used. The process can be emotionally and physically demanding, and multiple cycles of IVF may be needed to achieve a successful pregnancy. IVF has provided hope and an opportunity for many couples and individuals to have children despite experiencing infertility. As with any medical procedure, it's essential to consult with a qualified fertility specialist to determine if IVF is the right option and to discuss the potential risks, costs, and chances of success.